the story that we have about our experience um, can change over time, you get to be the protagonist. Like you get to um, find meaning, figure out what life looks like even after a really difficult diagnosis or medical experience.
Welcome to the Medical Trauma Support Podcast, where we come together to bring more humanity into healthcare. I'm your host, Sarah Stasica. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, I have Ingrid Nishimoto here with me, and Ingrid is a certified EMDR therapist in California. Ingrid, thank you so much for being here.
Hi, Sarah. I'm really excited to be here. Should I go ahead and share a little bit about what I do?
Yeah, I was curious if you would go a little bit more into the work that you do and who you typically see as clients.
Yes, I would love to do that. So I am a therapist providing individual in-person and online therapy. I'm located in Northridge, which is in the San Fernando Valley in North LA. And I just really love working with women in particular who are deconstructing and reconstructing their lives because they're used to being told they need to live a certain way. And I think of it primarily in terms of health and family / culture and faith. So especially for this podcast, I was thinking a lot about my own experience with medical trauma and how that shaped so much of how I work with clients who have really confusing diagnoses or notice the impact of their health and how they show up socially, how they engage with their work. So helping them to feel safe in their bodies, feel have more agency in their bodies. I'm sure we'll talk more about this. And to feel like they have a sense of direction and voice in their lives, because I know part of my story is it can feel very disempowering when medical stuff happens to you. So yeah, I really love helping clients reorient to their bodies, help them to feel like they can actually feel safe again.
That's amazing. I love that so much. That, I just feel like being able to feel safety in your own body it's so powerful. It's so empowering to be able to feel that sense of I'm okay. And even when the things around us are kind of spinning, to have just that stability that building a sense of safety inside creates.
Oh, 100%. That makes such a difference.
Yeah. Well, one of the things that I'm really curious about and that we often talk about on the podcast, usually people that are here on the podcast that are clinicians oftentimes have their own medical trauma history and experience. And that's oftentimes what brings us to want to help others with it. And so I was curious if you would tell us a little bit about your history. What is it that brought you to be doing this work with others and helping them navigate medical challenges, medical trauma?
Yeah, definitely. That is my story. I was born with a genetic cancer mutation called Peutz-Jeghers syndrome. I didn't know about it until I was 17. I was hospitalized for some intense abdominal pain, and that's when I was diagnosed. And basically, it shows up symptomatically as pigmentation on your lips, maybe your fingertips, and also polyps in your GI tract. So it can cause some really intense pain, telescoping of the intestines. And that's what brought me to the ER. And I was diagnosed. And the fallout from that was realizing it was right before I was going to go to college, right? So theoretically the whole world is before me. And then I was just blindsided. I'm what does this mean? What am I going to do with my life? Can I even go to college? I think for me, a lot of key developmental stages intersected with these kind of medical traumas or just other traumas. Because of my health experience, I really had to reevaluate what is my life going to look like. So yeah, that time in high school was huge. It really set the stage.
Yeah. And I think bringing that up is so important because medical things can happen at these really sensitive, like you said, key developmental stages in our lives. And I think it's easy for people that haven't experienced it or aren't thinking about it. It's easy for people to miss the significance of that and the significance that a medical diagnosis can have on somebody's life as they're going into these different stages. And, I had a guest on, it's been quite a while, but he shared about how he was diagnosed with cancer in high school and the impact it had on him socially to not feel well and to be going through that.
Yeah.
And so I was curious if you would just tell us a little bit more about like your own emotional experience as you've gotten this diagnosis and you've gone into the hospital at 17 and been in this place of like, am I even going to be able to go to college?
Yeah. I was reflecting on this and preparing for this interview, and I realized for me, my tendency is to like avoid or shrink and get small and to be like, well, I'm just not going to put myself in uncomfortable situations. So like, I even briefly considered like, maybe I won't go to college, but thankfully my health condition was not to that point. It did affect where I went to college because I thought about going to like a large public university and I was like really overwhelmed just being on campus. Like I remember a few months after my hospitalization, like trying to decide where to go. And then I stepped onto a campus and I'm sure there are other things going on too. But I think being at that moment after a health crisis, I was just like,
Yeah.
I'm not sure, like, can I handle this? And it was the same time I was starting this really strict homeopathic regimen called Gerson therapy that would require so much labor. And I wasn't quite sure how that would balance with like starting college. So I ended up going to like a smaller private Christian college for various reasons. But I think part of it was like just feeling a bit more sense of support and safety and just hopefully feeling less overwhelmed. And I wonder if that also kind of set this narrative of maybe I'm not as capable or have to be more hesitant in going for what seems like more challenging stuff. I mean, you could analyze that, but what am I capable of doing? I don't want to overtax myself because like maybe it's too much. Yeah. Does that make sense?
It makes a lot of sense. And it also really proves the point that it's not super like cut and dry, right? There's even when you're reflecting back on that experience, there is some, like, I don't know, was that the right thing to do? Why was I doing it? Was it because of, was it because of this homeopathic regimen? Was it because of, I felt like I didn't have the capacity? So I love that you shared that story because I felt in myself a little bit of that questioning. I could feel your questioning even now. And I just think it's beautiful that you're bringing that to the surface for other people to hear, for people who've experienced the same thing and are like, yes, I resonate with that. And then for other people to understand that when somebody's dealing with a medical diagnosis or a medical experience or, the trauma that comes after something, that it's a process. It's not black and white. It's something that we wade through and learn as we go. And it's not an overnight change. And that makes me think about quite a few people that I've talked to who go through treatment for something and they finish their treatment or they're released from the hospital. And then everybody's kind of like, all right, you're better. Yes. But there's the emotional processing of it that is a long journey.
Yeah. Oh my gosh. I've been thinking so much about that. I read this Substack article on the spectrum between like sick and health and how it's so vast. And I could totally relate to that. I've had a couple cancer experiences and the most recent one, like, I'm so grateful for people checking in and seeing how I'm doing. But there's also, I think it's hard to know, right? If you haven't gone through something like that, to be like, oh, you're all better, right? Like you're back to normal. And I was like, I mean, depending on the relationship, right? I'm not going to like go into this really detailed analysis, but I was like, oh, we have limited frameworks for understanding health and well-being.
Yes. Yeah. Yes. I love that. We have limited frameworks for understanding health and well-being. That's so true.
I think with my experience, there was definitely the crux of the intense treatment and all that stuff. And then there's the gradual regaining abilities and kind of returning to some normal, but it's also, my body has definitely changed. And I think there's a grieving process that comes with that. That's kind of hard to understand or even convey, right? If
Yeah.
our only understanding is like, you were sick and now you're well,
Right.
so we celebrate. But then like, well, there's so much in between. And I think that's also kind of a big part of the passion I hold for working with clients and helping them to be with themselves in the in between, right? Because they can vacillate between
Yes.
like, well, I should be all okay now. But it's like, well, no, like your body's still catching up. Your emotions can be gamut as well.
Yes. Well, when you were talking about the grieving, that is such a big, big piece to challenging medical experiences, a diagnosis that's unexpected, abilities changing, sometimes with like a chronic illness, not being able to do all the things you used to be able to do.
Mhm.
And I was thinking about how lucky your clients are that they
Mm,
get to show up with you as somebody who has lived experience and understands
mhm.
that grief is such a big part of it. And I was wondering if you would share a little bit about that process in your work and how you support people as they are grieving these things that oftentimes people don't realize are losses and things that we grieve. I think a lot of times there's like such a wide spectrum of different kinds of loss, how you approach that.
I mean, there's a part of me that's like, oh, this feels like a relatively milder example because I was working with a client who had like a skin condition that
Hmm.
they were feeling super self-conscious about. And I think until then, they were used to being a fairly healthy and just kind of a normal young adult. And um, with that onset, it really got them anxious about like how much can I even engage socially, right? And like they're
Yeah.
trying to date, they're trying to like hang out with friends, like go on trips. And so even though on the surface it's the thing itself, it's not as intense as like cancer or something else, but I'm like, no, but the impact, right? The traumatic response someone
Yes.
can have and the narrative that's associated with the
Hmm.
condition, how that can really affect their sense of safety in the world. For them, it was a lot of vigilance around like I have to be super careful around like what I can touch and do and how that affects them. So
Wow.
my work was just even helping them to acknowledge what was going on and to
Hmm.
like just slow down and pay attention, helping them to realize this is important for them to be honest about how it's affecting them. And I think for them, there's
Hmm.
also like a lot of complicated things about even going through this process. So having someone to talk about it, I think was
Yeah.
really impactful for them. And I've really thought a lot about like at the core, a lot of what I do, I think is like this being this compassionate witness and to like show someone like whatever
Hmm.
you're going through, your life really matters. Maybe it's not specific to like illness or like medical trauma, but since that's what we're talking about, that's what comes to mind.
Yes, I love that. A compassionate witness and just being there and like holding space for somebody, offering a space to be with them for the things that do come up. And I know that you do somatic work
Yes.
and that's, like a big part of that safety in the body is that somatic work. And I just think about that's a big part showing up with somebody and helping them reconnect with their bodies and find the safety is being that compassionate witness and like holding the space for them as what's coming up can come up, whether it is grief, like we talked about, or it's
Yeah.
anger or it's confusion. I think that's so beautiful.
Yeah. I think a lot of my work is very much, especially because my clients do tend to be overthinking. It's like, okay, let's slow down whatever is happening and really
Mm.
by modeling it myself, right? Helping them to be present for themselves to bear witness to what's going on in their bodies and
Yes.
not to bypass it and to be like, well, I should be feeling this way. I should be responding this way. It's like, no, your body has wisdom and there's a
Mhm.
reason it's talking to you. It's probably trying to tell you something. So like, we don't have to get stuck here, right? But like actually paying attention will help you to move through whatever it
Yeah.
is you're going through. I think sometimes, and I know I experience this too, it's like, well, if we like feel a difficult emotion, are we going to get stuck there? It's like, no, you won't.
Mhm.
But I think it's because if we can like give ourselves that permission and the space to move through the feelings.
Well, something you said made me think of when we haven't had the experience in our lives of really being able to safely slow down and check in with our bodies, it can feel like, well, I can't feel that because it might kill me. And I
Mm-hmm.
heard years ago that sometimes people have a hard time crying as adults because as children they were never allowed to just cry until they were done crying.
Oh,
So they haven't had the experience of, I can feel this feeling and it can pass. And I'm
yes.
not going to cry forever if I start crying, because I know there are so many people that are like, oh, I can't start crying because I don't know if I'm going to be able to stop.
Mm-hmm. That feeling of being out of control.
Yeah. And maybe when they were younger, they were told, stop crying.
Mm-hmm.
They were taught that expression of emotion was unsafe. And it was unsafe for the adults around them that didn't have the
Yes.
capacity to
Right.
hold it, right?
Yeah.
But that also taught that little part of them that's still living in them inside that it's not safe to cry.
Yeah. Yeah. I definitely have clients who have that story, and like
Yeah.
part of their healing has been to just notice when they feel like crying and like
Hmm.
give themselves that space to cry. And then they're like, okay, I feel better and I can move on. And like
Yeah.
not to shame themselves, right? I think the shame can definitely be a
Yeah.
strong narrative.
Well, and also I'm thinking about you being there as a compassionate witness, right? For somebody who may have been afraid to cry, but then they can be with somebody who's co-regulated with them and is, holding the space for them to be able to cry the first time and see that it ends. See that the crying isn't going to last for the rest of their lives just because they let it come out. So I think that's really beautiful.
Yes, very much, very much. Them having that experience in session, right? And then they can feel
Mhm.
like their nervous system shift and be like, I'm okay.
Yes.
Yeah, it's a corrective
Yeah.
experience for sure.
Yeah. That's
Mhm.
beautiful. I want to make sure too that we talk about
Yeah,
EMDR
sure.
because I know that you're a certified EMDR therapist,
Mhm.
and I would love to know more about that. There are a lot of people who've experienced medical trauma that are
Yeah.
curious about EMDR, and so I would love for you to share a little bit more about what that is and how you do that work with your clients.
Yeah, so EMDR stands for eye movement desensitization and reprocessing. It is body based and it doesn't require an extensive retelling of your trauma, which I think can be really freeing for people. It's very protocol driven. So there is like clear steps and guidelines for how to do it. And there's still like lots of wisdom in how you um, implement it. And with all my clients, I always do, of course, like history taking. That's like the first stage. And then like there's preparation and just like building resources and tools to help them
Mhm.
regulate, because EMDR can bring up, different thoughts, feelings, memories, dreams, and can
Mhm.
throw people off, right? Like you're like, oh, I thought I'd buried that and it's coming up. So like having different tools to manage that when it comes up in between or during sessions is a big part of my work. And of course, I just continue to assess like where they're at and what they need.
Mhm.
Um, and the bulk of, I guess, when we talk about EMDR that people refer to usually is like the processing of like a stressful or like traumatic incident, let's say from the past.
Mhm.
And it uses the term is eye movement in the title, but it's really like any form of like bilateral stimulation, or to some other theorists, it's like um, things that tax the working memory. Let's say with eye movements, like having dots or like tapping, fast tapping. And it goes at a fast pace because it stimulates both the left and the right sides of your
Mhm.
brain and helps you to stay in the present, but also in the past. And it integrates rather than like getting you stuck in the past, right? As a therapist, periodically checking to see what they're noticing. As you do these eye movements, you're going to notice different aspects of the incident that you're targeting. And the eye movements have a desensitizing effect. They help to bring down the level of like emotional charge that's associated with the event. It doesn't
Oh, how
obviously get rid of what
interesting.
happened.
Yeah.
Yeah. So like the event still happened, right? But the idea is the negative charge that's associated with it is connected to a negative core belief you have about yourself. So like, let's say you can have a really difficult medical experience, right? Like you get an
Mhm.
diagnosis. And there's all the stuff that's associated with it. With EMDR, you can reprocess it and see it from a different angle. You can experience it and it can not have that same emotional charge, and you can have a
Yeah.
different belief about yourself. And it's a more nuanced, adaptive belief. Rather than I'm powerless, it might move to like, okay, I have agency. I can control what's under my control. A lot of it is like, especially when it's rooted in childhood, right? Like childhood beliefs are more
Yeah.
black and white. And as we get older, it gets more gray, more nuanced. And so being able to update your system into like, oh, I'm an adult. I actually have tons of tools. I've got tons of resources. I've been able to go through a lot of hard things and made it out alive. So kind of reminding that younger self of like, you're not that anymore.
So interesting. That was so interesting because I didn't know that the eye movement was actually helping to desensitize from the charge that's coming up when we're
Yes.
bringing it back up. And it makes me think about one of the nervous system practices that I teach people, and that's called orienting.
Yes.
And we're using our eyes to look around the room. And it's really meant to slow you down, let your nervous system really see where you're at in this present moment. And
Yeah.
so I'm so curious if some of the same things that are helping in EMDR to help bring down the charge are also happening when we're doing this orienting and bringing ourselves into this present moment.
Yeah. I mean, that makes sense to me.
Then the other question I had, Ingrid, I don't want to rush us off of
Yeah.
that, but I was so curious as you were talking about um, how the nervous system responds after an event that was really scary, traumatic. After that event has been reprocessed,
Mhm.
does it take a while for like the autonomic nervous system to realize that a change has happened, or do you see that shift kind of throughout both cognitively and throughout the body with your client to a process? Like, I'm thinking of somebody who maybe had a really intense medical experience and then they don't want to walk back into a hospital, or hearing a siren would cause an immediate panic attack. I'm curious, after somebody who's had that kind of experience does a reprocessing, what is it like for them after? Does their body feel like, oh, I'm doing okay when I walk into the hospital? Or is it a longer journey?
Yes. That's a great question. I'll answer it in two parts. So immediately, like during the reprocessing, like part of it, I forgot to mention this, is checking with the body and doing a
Mhm.
scan and like noticing what has shifted. And yeah, so the goal is to get to like calm, no disturbance. So we check in on like thoughts, feelings, sensations,
Mhm.
whatever else comes up too. But like people will notice, right? They'll check in and be like, my breathing's a little steadier, like I feel more relaxed, like I'm sitting up a little bit taller if they were feeling more collapsed. So
Mhm.
they notice that shift. After EMDR, we always check in and see how things are going. Yeah, it can vary, right? Like sometimes they're like, oh yeah, I noticed an immediate shift. And
Mhm.
sometimes they're like, oh, I did feel triggered again. And they usually won't get stuck in that place. They realize
Yeah.
like, oh yeah, no, I can update my system and like I can like bring in this resource, or I can remind myself of have agency. It's an ongoing process. It's definitely not overnight. And my experience is that clients will more and more feel that like confidence and that competence in themselves as they're
Yeah.
like encountering situations.
I want to go back to that powerless part. A couple times you've brought up the powerlessness, right?
Mhm.
How often that happens when we are in scary medical situations. And I feel like that loss of control is such a huge piece. Like that's like seems to be like a really crucial piece for most people of why the event was
Mm.
traumatic for them.
Mhm.
And I'm
Mhm.
curious if you would talk a little bit more about that powerlessness part, because I can tell from what you said that that's something that comes up
Mhm.
when you're working with clients and in EMDR.
Yeah, I was thinking about it being connected to survival and like I'm
Mhm.
gonna die. Like I think it is all still connected to the like sense of powerlessness.
Yeah.
And well, right, like somatically how that lands, right? Just that kind of collapse, that like even posture, right? We can like get
Mhm.
really small and feel more of a freeze response, right? A shutting
Yeah.
down of like, it doesn't matter, right?
So, like, yeah, what you said about like it doesn't matter. Like,
Yeah.
I feel like that's such a so, for the audience, because Ingrid, I already know that you're very familiar with all of this, but for people listening, shutdown and collapse is such a common experience in medical settings. Sometimes it happens even when you're like going to a checkup, right? Because your nervous system is saying, this is unsafe. I can't run. I can't run away. I can't fight. And so collapse is like the nervous system's way of protecting us. And so when you use that phrase, Ingrid, for powerlessness,
Hmm.
oof, I could feel that. And I was just thinking about an experience. I'm writing a book right now, which is exciting. And also it's
Cool.
hard to find time, but
Yes.
I will say that I wrote one of my experiences. I'm in a writing class and I read this last night to the other women in my group. And as I was writing it, that was a big part of it was that I had no control over what happened. And oftentimes when we also have earlier experiences of having no control, it's like
Hmm.
compounded. And then in that experience, I left. I don't even know where I went. Okay. My
Mm,
body was there. I was gone. And it was a
mm,
well-worn path just because of my, earlier experiences, trauma experiences in life. When you talked about powerlessness and that collapse, it brought that back up for me. And I think
mhm,
a lot of people listening have either experienced that in themselves or witnessed it as, a medical practitioner maybe has witnessed this happen to people, but also we witness it with like our loved ones, right? When they're going through something really scary and hard, we may be able to literally like see the collapse, right? Like you said, you'll
mhm.
see people's bodies kind of curl in and the energy level goes really low because our nervous system is trying to protect us and kind of prepare us for what's coming, right? What our nervous system can feel like, okay, we're going to die or we're going to be really wounded. And so that collapse is a
Mm. Yeah.
protective thing that our body is
Yeah.
doing for us. And then, oftentimes after the fact, we'll go home and we'll be like, oh my God, I couldn't say anything like, oh, and have a little bit of that shame come up and a little bit of that embarrassment. And so I'm
Mhm.
hoping that people listening that hear this can have a little bit more self-compassion for themselves if maybe they did shut down or they felt collapsed. It's just such a common thing for us as humans when we're in a really hard situation.
Yeah. Yeah, no, as you were talking about that, a few examples with some clients came to mind, like
Yeah.
one person like navigating through some of their own health stuff, and they actually work in the
Mhm.
like medical field. So they're
Mhm.
like, if I'm having trouble and like, yeah, and just the
Yeah.
overwhelm that it brought them. It was a lot of red tape that they're running into issues with just navigating the healthcare
Mhm.
system. And I know we've
Oh my
talked a little bit
gosh.
about just the like
Yeah.
mental load of working through all that and the overwhelm of that experience. And I think part of our work was to like, yeah, give some self-compassion and to like
Yeah.
acknowledge the impact that they were feeling and then to like figure out like what they had capacity to, right? Not like they
Right.
had to resolve it all, right? But to be like, what can they do in this moment? And I think that goes back to the
Yes.
nervous system work, right? Like we can titrate, we can
Yes.
like be super compassionate about our bandwidth in any given moment.
Yes, I love that capacity. And I think that that's a big part of what shifts when we have a compassionate witness, like you talked
Yes.
about earlier, when we have a compassionate witness who has regulated themselves, who can sit with us as we stretch the limits of our capacity and
Yeah.
and then
Yeah.
we've done that, we've done the crying or we've done the anger, and then we have like a little bit bigger capacity to be with it the next time we go to a doctor's appointment or do something challenging.
Yeah. I'm thinking of another person who them going through their own struggles with navigating family members,
Mm,
medical stuff. And it brings up their own worries and fears, right? And the powerlessness that maybe they were already feeling and that can be amplified by
Yes.
these medical traumas, and helping them to find their voice, find ways to advocate, find even a place for anger of it's okay to feel angry. That actually makes sense for what you're going through. And
Yes.
repressing it actually isn't going to help, right?
Yes. Well, I had a whole podcast episode with Sasha McBain on
Oh,
anger and medical trauma because anger is so common. It is such a common feeling experience for people who've experienced medical trauma. And it can
totally.
also be, we can get stuck in it, but it can
Yes.
also be some protection from the emotions and sensations that
Oh,
feel a little more vulnerable and sensitive
mm,
that are kind of
mm.
underneath it.
Yes, it could definitely go multiple directions.
Mhm.
I think, yeah, I wonder like if it depends a little bit on the person, like what it can like move them towards. Like for some people, it's like maybe that anger is good to get in touch with because it moves them to like fight, right? And like kind of
Yeah.
pull up some of their life force energy. I'm actually thinking about my own
Yes.
experience with like navigating um a diagnosis process where it was like confusing. There were a lot of mixed messaging, and like the providers were upfront with me that it was a bit gray. And while there's a
Mhm.
part of me that's appreciative of the transparency, I think it was the particular way that this was handled by this provider where I was like, oh, this is not building trust
Mhm.
in you. And I use that to be like, I need to like ask for someone, a specialist with this
Yeah.
experience who can like help me. And thankfully that person was very willing to like connect me to that person. And I definitely
Mhm.
felt more um, contained with the next with that provider. Just the way they carried themselves and their experience definitely made me feel more safe. But yeah,
Yeah.
I could see myself in previous times where I can feel like intimidated by doctors
Mhm.
and be like, oh, like, do I really know? Can I speak up for myself? But at the end of the day, I'm like, I know my body and I've done research and I'm not an oncologist, but I'm like, I know some things and I'm going to speak up as much as I can for myself.
Yeah. Yeah. I think that's so beautiful because, yeah, a lot of times anger can get a bad rap. And it's
Hmm.
like anger does, it does bring us into that energy of setting firm boundaries, advocating for ourselves, asking for what we need.
Hmm.
Yeah, which is part of this journey, right? Like part of this journey. And for so many people's stories they've shared is there was a period of time where they were in shutdown and collapse or
Hmm.
periods of time where they're fawning. And
Yes.
as they process and learn more about themselves and learn about their nervous systems, then they start to step more into that role of advocating for themselves, like really fully believing I am the expert on myself. This is my body. I am the only person that's lived with this body my entire life. I know myself.
Yes. Yeah, very much. I'm thinking of people I've worked with where, yeah, I think previously their default would be to like fawn, right? To like
Mhm.
limit engagement. I think as they've experienced like their own or family members' medical trauma and realizing like
Mhm.
I need to be the one who speaks up, right? Like no one's
Mhm.
gonna like fight for me like I will or my family,
Yeah.
and how it actually has motivated them to like really, I think, take more ownership of their lives.
Yeah.
Yeah. So
Yeah.
yeah, it can be channeled beautifully.
Ingrid, I'm just really thankful to have you here because I think that you bringing both your lived experience and your, clinical experience as a
Mhm.
therapist and a certified EMDR therapist, is really beautiful. It's like you've got like deep layers of understanding that I think people can feel. I know me as a client, when I show up with somebody, I can feel if there's some real depth, and it usually comes from
Oh.
self-awareness, right? And our own lived experiences, and then the process of how do we keep going after these hard experiences? How do we care for ourselves? How do we heal? How do we process and make meaning of the things we've experienced?
Yeah,
Yeah.
they keep going. The make meaning for sure is so
Yeah.
big. Yeah.
Yeah. So, what I like to say at the end of each of
Yeah.
the podcasts is to ask the guest if there is something that they really want to make sure that the audience hears and leaves this podcast episode with. And I'm curious what you would like to share.
Yeah, such a good question. I think the main thing that comes to mind is like how the story that we have about our experience can change over time. And you get to be the protagonist. Like you get to find meaning, figure out what life looks like even after a really difficult diagnosis or medical experience. Just even in the gray, I think that can happen with these situations. Like there's still hope. My new logo is like a firefly. So like I love like kind of the image of like firefly, a light and darkness.
Yeah.
That's
Yeah.
what I want to leave with.
That's so beautiful. And that light and the darkness, that's so beautiful. And is there a way that people that are listening can get in touch with you?
Yeah, they can find me on my website, ingridnishimototherapy.com, or you can also email me, ingrid@ingridnishimototherapy.com. Yeah, I would love to chat. Drop me a line. Love to connect you with resources if I can be of help.
Yeah. Thank you so much for being here and sharing both your lived wisdom and your clinical wisdom. And it's been so nice to talk to you.
Thank you so much for this opportunity. It was really fun. Love geeking out about the nervous system.
Me too. Thank you so much for being here and for caring about bringing more humanity into healthcare. And if this conversation meant something to you, please share it so more people know they're not alone in their medical experiences. You can find resources, education, and our peer support community at medicaltraumasupport.com. And if you enjoyed this episode, please follow, subscribe, and leave a review. It really helps more people find this podcast. Take care of yourself, and I'll see you next time.